As the war continues to take a catastrophic toll in Gaza, children are the most affected with lack of medical facilities and enough doctors and specialists. Those with complicated medical conditions are left more vulnerable. Around 5,000 people have been evacuated for treatment outside Gaza, with over 80% receiving care in Egypt, Qatar and the United Arab Emirates. South Africa has also received those who need medical care after being evacuated from Gaza. Since October 7, 2023, life has changed beyond recognition for the 2.2 million people living in the Gaza Strip. While children are always the innocent victims of any violent conflict or crisis, the impact of this war on children is unprecedented, with over 17,000 killed, over 20,000 missing, 10,000 more that are displaced, separated from family, trapped under the rubble, and many who have not been identified, not being collected as well. News Central's Bongani Siziba is at the OR Tambo Airport, where one of the kids, better still, are indeed jetting in this morning. Let's join her now. Bongani, once again, thanks for being here. Earlier on, we had spoken to you on Breakfast Central, but here on News Now, can you confirm to us if any of the children have arrived at the airport? And what's the feeling like, especially what's the mood like there?
Good morning, Joe, once again. I saw tears from the people who are here at the airport. Quite a number that came in just to welcome the baby son at 1-year-old who just jetted in from Egypt. We know that he was taken from Gaza and to Egypt. And what some of the doctors here in South Africa are doing, that they came together and they grouped up, and they are trying to help those children in Gaza, those who need specialist doctors. So they are bringing them to South Africa, also with the South Africans coming through just to welcome in that baby. A few minutes ago, that baby just came through, and I saw tears from many people who were here, just seeing the baby with wounds, seeing the baby waving and being happy to get that second life. But with me, I have some of the people who were here just to hear them what this initiative means to them. Let me bring in some of the people that are here. Good morning, and thank you for joining us here at News Central. This initiative, how important is it?
This is an extremely important initiative. We are bringing children from Gaza for treatment at Raslo Private Hospital. I am a representative from MLSA, and we've worked hand in hand with PCRF, who have arranged for these children to be evacuated from Gaza and arranged the travel so that they could get here to South Africa. So without PCRF, we wouldn't be here. This is a doctor. She can give us a bit more insight into, this is Dr. Mitha. She can give us a bit more insight.
Okay, doctor, what kind of mental health do these children, what are they going through? We saw some of the children yesterday, and today we saw a 1-year-old coming through. He was smiling, but deep down you can see that there are scars within.
It's indescribable, the heartbreak and the distraction that these children are witnessing. You can't imagine a life where you don't know when the next meal is coming. You don't know if your father is going to be there the next day. You don't know if your brothers and sisters will be there the next day. It's a childhood that no child should experience, and hearing bombs from every corner of your world, it's something that we cannot fathom, and it's so heartbreaking. We're just trying to help in any way that we can, but we can help medically, but in terms of the mental damage, we can only hope that they can get the help that they need.
So in terms of mental health, I know at Raslo Private Hospital, we are working with some psychologists that will address the children's needs and obviously evaluate and see where it goes, because they're dealing with severe PTSD, coming from this war-torn background.
What are some of the injuries that these children have?
Okay. So last week we received Mira, who came in, and she also had burns on her body, which require specialized grafts. She also had a fracture, which is slowly healing. And I think one of the things that they mentioned was osteomyelitis, which they picked up in the testing as well. We then received Lena, about 2 days ago. And she was also involved in an explosive incident where, bystander, unfortunate situation where she was a bystander and she was hit with this explosion. And so she fractured her hip. And so the doctors are also waiting to let us know what's going to happen in terms of her treatment.
Thank you so much. Thank you so much for joining us. This is what some of the children who are in Gaza, what they are facing. And these three that are here in South Africa are getting a second chance, a second life. Doctors will be looking at them and try to see how they can help them. But there are many that are in Gaza who couldn't come here, but who will come here. But some of them are dead. They are innocent, have been taken away by this war. Gaza children are suffering this war. Like I've spoken to one journalist who came in from Gaza, and he was narrating to me what kind of experiences that they are going through there in Gaza. But thanks to South African doctors and South Africa, that has come in just to help some of these children. It's back to you in the studio now, Joe.
Thank you so much, Bongani Siziba. A very, very touching moment there. Well, we'll get back to you and get more updates.